initial annual wellness visit, and the code we use for this is G0438. Okay, the purpose, the first annual wellness visit focusing on prevention and personalized health planning for the beneficiaries after 12 months of Medicare Part B enrollment. Okay, before 12 months initial enrollment we will give G0402, which is IPPE. Okay, after 12 months of enrollment we are supposed to use G0438. G0438 only we have to use. So it requires no IPPE or AWV, that is annual wellness visit, in the past 12 months, and it focuses on health risk assessment, screening schedule and personalized prevention plan. So here they are saying requires no prior IPPE. So as I said, in the 2025 patient got enrolled to Medicare. So the whole 2025 Jan, okay, this January patient is enrolled into Medicare plan. So the patient will be having complete 2025 as an initial enrollment. Okay, so we will be using, if patient comes within 2025, we are supposed to use G0402. Assume patient did not come in 2025, he came in 2026 July, okay, June or July. So in this case, though the patient has not taken initial preventive service, though we have not billed G0402 for the particular patient, we have to go with G0438. Why? Because the patient did not come in within 12-month plan. He is coming after 12 months. Okay, so again we go with G0438, and again this is also limited code, once in a lifetime. Okay, next after G0438 we have one more code. So this is subsequent annual wellness visit. So here follow-up wellness visit after the initial annual wellness to update health plans and monitor progress. The code is G0439. So it applies to all annual wellness visit after the first one, requires at least 12 months since the last annual wellness visit. So this G0439 we will bill once in a year. Okay, and this will be a subsequent annual wellness visit. So here how in 2026 we build G0438, okay, as a initial wellness visit, and in 2027 if patient come back and take annual wellness, that will be considered as subsequent, since we already built G0438. So we will code G0439. And 2028 if patient come back for the subsequent annual wellness, we will bill G0439 only. Okay, so all of the rest years we will continue to bill G0439 as a subsequent annual wellness visit. And this initial G0438 and G0402 both are limited code, and we will bill once in a lifetime. Okay, and this G0439 within a 1 year, if patient is coming back for a 2 times annual wellness visit, then we should not code one more time. Okay, so only once, one per 1 year, G0439 we have to code. And then we will see with the coding guideline, so we will understand. So coming to coding guideline, here we have G0438 is the first annual wellness visit only, and it is paid only once in patient lifetime. So as I said earlier, we will pay G0438 only once in patient lifetime. And G0438 and G0439 must not be billed within 12 months of previous billing. Okay, so there should be 1 year gap, and within a 1 year if patient is again coming back for annual wellness visit, means that we are not supposed to code it as an annual wellness visit. Okay, so there is a 12-month requirement. And then if the claim for G0438 or G0439 is billed within a first 12 months after effective date, patient Medicare Part B coverage, it will also be denied. So we will get denial if we bill. And then when provider performs separately identifiable medically necessary E&M service in addition to annual wellness visit with PPPS, CPT codes 99202 99215. So our office visit ENM codes we can use only when if the provider address any new acute problem. Okay, if we get to know any medical necessary is there to bill one more ENM, we can utilize our office visits. Okay, by using modifier 25 and using wrong primary diagnosis code. So here also we should not use any acute condition or chronic condition as a primary diagnosis. Instead we have to use our G series code, the annual wellness code. G0000 is for without abnormality and G0001 is with abnormality codes. Okay, in the previous video regarding ICD coding I have clearly explained, so please go back and check. Yes, as I said, we will use G00 and 0 series as a primary diagnosis whenever we are coding for annual wellness visit. Okay, these are the coding guidelines we have. And one more, actually, there are two more criteria to be discussed, but that is not required for examination. For CPC, it is not required. So if you want to learn, I'll just give an idea. So we have advanced care planning. Okay, advanced care planning, it's an additional service, and again that codes are like 99497 and 99498 series, which is based on time. And with this G0402 code set, one more criteria we will use, that is FQHC. Okay, FQHC is federally qualified health center visit. So again, those are not required for CPC exam. In future I may explain that also. But as of now, for CPC, that is not required. You only need to know the proper guidelines regarding annual wellness visit, and you should know the coding guideline for G0402, 438, and 439. Okay, that is enough. So we will see the scenarios. You will clearly understand. So coming to practice question, the first question, Mr. Brown recently turned 65 and enrolled in Medicare Part B 1 month back. Her doctor schedules a visit to review her medical history, check her blood pressure, screen her vision, and discuss the preventive measure. Which code represents this visit? So you can see here, patient recently turned 65 years and enrolled to Medicare 1 month back only. So here you should know the guideline regarding IPPE. IPPE is initial preventive physical examination. So here what we do, the guideline says after enrolling to Medicare, we will have the 12 months time frame. The patient comes within 12 months of enrollment, we have to go with IPPE. Okay, so IPPE code is G0402. The correct answer for this particular question is G0402. And next, second question. Mr. Carter has been on Medicare Part B for 15 months and did not complete an IPPE, and he now wants to start preventive care plan. During his visit, the doctor reviews his health risk assessment and creates a personalized prevention plan. So here, after enrolling to Medicare, like the patient enrolled to Medicare and it's already been 15 months and he did not complete an IPPA. That means within 12 months of initial enrollment, the patient did not come and did not take the initial preventive examination. And he now wants to start preventive care plan. Okay, after 15 months of enrollment, he wants to take the annual wellness preventive plan. So what would be the correct code? So G0402, can we bill for this scenario? We cannot bill for this scenario because it's already more than 12 months. It's been 15 months of enrollment. Next, G0438, it's a initial annual wellness visit. We will bill after 12 months of enrollment. Okay, so we will go with G0438. And remember, it is once we bill in the patient lifetime. It's a limited code. G0438 we will bill after 12 months of enrollment to Medicare plan. So the correct answer for this particular scenario is option B, G0438. So next scenario, Mr. Green completed her initial annual wellness visit last year. Okay, she now returns for follow-up visit where her doctor updates her personalized prevention plan. So last year she already taken initial wellness visit, and this year she wants follow-up. Okay, so you have to also remember to bill this codes. We will only bill once in a year. Okay, G0439, which is subsequent. So this is follow-up. Follow-up is considered as subsequent annual wellness visit. So we have to go with answer G0439. Okay, and as I said, the coding guideline. So if the patient has taken, assume G0438, you have billed in 2025 January. Okay, next 2026 January, if patient is coming, you have to go with G0439. Okay, anyway, you met the 1 year criteria here. So you can go with G0439. And the same way, 2025 Jan patient take the annual wellness visit. G0438 you have billed. Next in 2025 December, not December, maybe in the August, patient again came back for follow-up. So this time you cannot bill G0439 because you have not met the 11 months or 12-month criteria. Okay, so we cannot bill G0439. So the guideline says we should have a 1 year time frame in between. So then only we are used to we will use the subsequent codes. So this particular scenario G0439 is a correct answer since the patient has already taken initial wellness visit last year and currently wants follow-up. Follow-up will be considered as subsequent. Okay, and G0439 is not a limited code. So next, in upcoming years, whenever the patient come for follow-up, we will code G0439 only. Okay, we cannot go back and code G0438 or G0402. Okay, so that's all guys. So I just wanted to give you an update or a short information about this particular annual wellness visit since it is important for your CPC exam. Okay, we have many other coding guidelines. When we are working, we will apply, but for exam, you should know this basic information. This is enough. Okay, so if you have any doubts, please comment and please do subscribe to my channel and please do share with your medical coding friends. Thank you for watching.